Hello and welcome to Pay Entry's presentation of the Affordable Care Act, Navigating Through the ACA Mandate. Before we get started, we want to point out that the information found in this presentation is an interpretation of the components of the ACA. You should confirm this information and how it affects your organization with your legal advisor or ACA expert. The ACA mandate states that applicable large employers must offer an affordable health care insurance plan that provides minimum essential coverage to a percentage of their full-time employees or face a penalty. We are going to break down each component of the mandate to make sure we understand what it means. Starting with, what is an applicable large employer? Well, the term applicable large employer refers to any employer who averages 50 or more full-time or full-time equivalent employees in the look-back measurement period of up to 12 months. Please note that just for the reporting year of 2015, ALEs with 50 to 99 full-time or full-time equivalent employees will not be subject to penalties for not providing insurance. For more information on determining your applicable large employer status and how to run the estimate report in Pay Entry, see our ACA Large Employer Estimate Report video located in Web Help. Next, we are going to focus on the affordability portion of the mandate. It states that applicable large employers must offer affordable health care insurance plan. So what exactly is considered affordable? Well, according to the mandate, a plan can be considered to be affordable if the employee's required contribution amount for self-only, or rather employee-only, coverage does not exceed 9.5% of the employee's household income. The problem with this is that the employer has no way of knowing what the employee's household income is. So to get around that, they created some safe harbor alternatives to calculate affordability. For example, the employer can use the employee's W-2 wages, rate of pay, or the federal poverty line to calculate if the premium amount is 9.5% or less than any of these. If it meets that criteria, then it is considered to be affordable. Now we are going to look at minimum essential coverage. This addresses how much the insurance plan is going to pay. The mandate indicates that the insurance must cover at least 60% of the total allowed cost of benefits that are expected to be incurred under the plan. If it meets this criteria of 60%, then the plan is considered to meet the minimum essential coverage criteria. Next, we will dive into what the percentage of full-time employees is. For the year 2015, employers with 100 or more full-time employees will need to cover at least 70% of those full-time employees. Starting in the year 2016, employers with 50 or more full-time employees will need to cover 95% of those full-time employees. Let's do a quick review of what constitutes a full-time employee versus a part-time employee. Full-time employees are those that average at least 130 hours or more in a month, whereas part-time employees are those employees that average less than 130 hours in a month. Full-time equivalents are used only in determining your ALE status or your applicable large employer status, and is calculated using the amount of hours worked by all the part-time employees to determine how many full-time positions that would equal. The final part of the mandate deals with facing a penalty for non-compliance. There are a variety of reasons why an employer might be penalized. Some of those reasons include if even one employee receives a government subsidy The employer could be penalized, not offering health coverage to 95% of all the full-time employees, or in the year 2015, it's just 70% of the full-time employees. If the employer does not offer coverage at all, or does not offer affordable coverage, or if they do offer health care, but that does not provide minimum essential coverage. Also, if the insurance does not cover the dependent children under 26 years of age. These are just a few of the reasons an employer might get penalized. Please make sure to review your plan with an ACA expert to ensure that you are in compliance. This concludes Pay Entry's presentation on the Affordable Care Act, navigating through the ACA mandate.